Okay. Apologies for a little bit late. Just want to let you know there is a Spanish channel. If the participant need to be this to be in Spanish, please dial into the Spanish channel. Welcome, UC Berkeley Katie SAP team. Steve, you can go ahead and introduce your team.
Thank you so much for having us. But yeah, so we are Katie Sapp at UC Berkeley. My name is Stephen Huynh. And just a brief introduction of who we are, Katie Sapp. Katie Sapp stands for Kidney Screening and Prevention Program. Sorry, Kidney Kidney Disease Screening and Awareness Program. And basically, we just go around the Bay Area community and we provide free screenings, free and accessible screenings for underserved communities. And so at these screenings, we do provide language interpretation for those who may need them. And you don't need to bring any paperwork. So they are free and accessible. And we, of course, host awareness presentations just like these to spread information about what chronic kidney disease is, which we are trying to prevent and mitigate as much as possible. And so here with us today, we have a variety of presenters, and we will be presenting four decks for you today, which are one, the main deck, which basically just describes what chronic kidney disease is and presents a few statistics. We will then be presenting about exercise in relation to chronic kidney disease, then transportation, and finally finish off with nutrition. So without further ado, Annie, if you could start us off, that would be great.
Nice. Hello, everyone. My name is Annie Lee, and today I will be talking about kidney disease. And this is important to learn because you want to see how this impacts you and how it impacts your loved ones. So it is important to make sure you go to our kidney disease screenings because it is the ninth leading cause of death. And 50% of people don't find out until it's too late. Hence why these awareness screenings will help us prevent kidney disease before it gets worse. So basic kidney science is that we have two kidneys and they're located in our rib cage and our lower back. Uh, each kidney is around 11 centimeters, so it's the size of your fist. So some more information about kidney science is that it filters out the blood, it excretes waste, it also reabsorbs important nutrients so they aren't lost in urine. It also regulates blood pressure and regulates the concentration in your blood. So what happens when your kidneys fail? So kidneys can be damaged through physical injury and disease. So when that happens, you're losing the ability to filter waste products like poop or pee from your blood. And if this accumulates more in your kidneys, your blood chemical may be altered and out of balance. So the symptoms of kidney disease failure is having seizures, pain around your chest, having nausea, dry and itchy skin, and muscle cramping. You can also have poor appetite, and inside your body, your kidneys might shrink in size, but you aren't aware of that unless you go to our screenings or get something detected. And there will be excess urine production, and because of the excess urine production, you'll have urine in the blood and it'll be more foamy. Do you guys think that you could be one of the 3 Americans at risk for kidney disease?
So my name's Savon Rosen, and I'm going to be talking about why your kidneys might fail and who is most at risk for having chronic kidney disease. So some of the reasons that your kidneys might fail is due to high blood pressure, diabetes, your family history, or heart disease, which could be caused through drug and medication use, smoking, infections, or immune problems. So, one of the groups that is more susceptible to chronic kidney disease are elderly people. So they're at higher risk, and the probability of acute kidney injury for Medicare patients age 66 plus is 48%. 24.2 million people age 65 plus have diabetes. and cardiovascular disease complications can arise from chronic kidney disease. Even though elderly people are more susceptible to chronic kidney disease, that does not mean that infants and adolescents are not safe from chronic kidney disease. So for infants with birth defects, congenital abnormalities, and hereditary diseases can cause chronic kidney disease. For teenagers, the inflammation of kidneys and other damages and syndromes are causes of chronic kidney disease. And for young or adults who are not 66 plus ish, diabetes and high blood pressure are the most common causes of chronic kidney disease. Additionally, there seems to be a greater risk for chronic kidney disease in veterans. It's about 36% compared to 14% in the general population, and about only 26% of veterans who had evidence of chronic kidney disease were aware that they had chronic kidney disease. Additionally, aside from age, there are some people who are also more disproportionately affected. That includes African Americans, Asian Americans, Indigenous Americans, and Latinx people. African Americans are 4 times more likely to be diagnosed with chronic kidney disease. Latinx Americans are 1.3 times more likely to be diagnosed with chronic kidney disease. And Asian Americans are 2 times more likely to be diagnosed with chronic kidney disease. Indigenous Americans are 1.2 times more likely to be diagnosed with chronic kidney disease. And so basically, if you are in any of these groups, it's really important that you get screened to ensure that you can catch it before it's too late.
Hi everyone, my name is Kirby. I'm going to be going over a few of the treatment options that are available for chronic kidney disease. So as I'm sure many of you are aware, there is dialysis, which is the process by which a patient's blood is filtered through a machine on behalf of a failing kidney that no longer functions. And so this is typically reserved for those who have lost anywhere from 85 to 90% of their kidney function. The other option, which is a lot more drastic, is kidney transplant. A patient would receive a kidney from either a living or a deceased donor that goes through an extensive screening process to make sure that they're a viable donor. They have to be 18 years or older, and they have to be in good health. So those with end-stage renal disease, along with long-term dialysis patients, are typically eligible for this treatment. So I'm sure this number's changed by now, but as of the time making the slide, there are 109,293 people currently on the wait list. And this is based on the United Network of Organ Sharing, which is essentially a registry for organ donation in the United States. Once you're on the wait list, there's typically an average wait time of 3 to 5 years. So as scary as it sounds, CKD is actually easily preventable if you're making sure you're doing the right things in regard to your health. So a few of those would be eating right, regularly exercising, limiting your alcohol intake. If you are smoking, stop smoking. And if you don't, then you're good. And as well as attending regular physician checkups or screening. So one of those things is nutrition. Components of a healthy diet, they would have to be adequate, make sure you're eating enough, moderate, not eating too much, balance. Everyone's heard about food groups, making sure you're eating like all the nutrients you need. And then one of the things that helps with that is nutrient dense food. So you're getting more bang for your buck. And it ties in with a varied diet as well. So a few tips we have for leading a nutritious lifestyle is to choose and prepare food with less sodium. That means reading a lot of labels, staying away from processed foods, maybe using not the entire shaker of salt when you're cooking, eating the right amount and right types of proteins. So red meat, heart disease, and chronic kidney disease are very interlinked. Red meat can spell really like bad results for your heart health as well as your kidney health. That ties in with foods that are generally good for your heart. So things that are low in cholesterol, low in sodium, et cetera, et cetera. and then the foods with the correct amounts of potassium as well. Potassium is an essential nutrient. It's something you need to be effectively functioning, and as long as you're making sure you're getting the right amount of it, it should be great. Yeah, so here's some tips on exercising as well, and I think I can pass it off to you.
Yeah, so here are some tips on exercising in relation to chronic kidney disease. So to prevent chronic kidney disease or the development as much as possible, you should aim for at least 30 minutes of exercise each day. And it doesn't have to be too extreme. It can be light and it can be as easy as walking for 30 minutes a day. I know this may sound like a lot to some of you, but step by step, take it step by step. You can start with 5 minutes a day and then gradually work up to more lengthier times. And by the end of it, you'll be walking 30 minutes a day, and that's a great thing for your kidneys. You can also explore activities such as yoga, meditation, and Tai Chi. These are known to be less extreme forms of exercise, so those are great opportunities as well. These are just some examples that you can follow. For seated physical activities, you can do something as simple as circling your arms around and just like moving your arms around, doing seated exercises, just making sure that you are moving in some way and not just sitting in a chair, just sitting there. Because I know that our lives are quite busy, and some of us may work in an office, and that demands a lot of sitting. So just making sure you're just moving as much as possible could be really beneficial for your kidneys. And then, as I explained earlier, there's a sample walking program right here to the right. You can begin walking with 5 minutes slowly, and then gradually work up the minutes, work up your endurance, and work up your physical mobility. And by the end of it, you will be walking 30 minutes a day in no time. And that is something you should strive for because it could be very great for your kidneys. But again, it's not something that you have to do. Just making sure that you do some sort of physical activities, such as seated physical activities, could be good for your kidneys. And then, of course, you can also get screened for kidney disease. And this is the main point that Kidney SAP does. And we host a variety of stations at these screenings, which consist of blood pressure, urinalysis, blood glucose, BMI, and we also do a physician consult right afterwards. So at the physician consult, you have all of these results and you show them to the physician, and they basically explain what your results mean. They explain, is this good for your kidneys? Is this bad for your kidneys? Maybe what adjustments you might need to make to your lifestyle that would better your kidney health. And so we do offer that. And as I said before, these screenings are free and accessible. And so if we do come nearby to a community near you, we would love for you to come and have us screen you. So yeah. And that is it for the main deck. We will then be moving on to exercise. If you could give me a moment to briefly transition to that real quick. Okay, could you give me a thumbs up if you can see that? Okay, great. So yeah, Charity, could you please start us off?
Yeah, so hi, I'm Charity, and I will be expanding a little bit more on the relationship between exercise and chronic kidney disease. So just to redefine what chronic kidney disease is, we define CKD as a long-term condition where kidneys gradually lose their ability to properly filter waste and excess fluids from the blood, and it's often a result of underlying health issues like diabetes, high blood pressure, obesity, or certain other kidney conditions. So to define obesity, It's a long-term health condition that occurs when excess body fat impairs health, and we measure it through BMI. So obesity is a major risk factor for kidney disease, and it increases chances of getting CKD by about 25% in one's lifetime. And we see that CKD in about 20 to 25% of patients is caused by obesity. It also increases the chances of hypertension and diabetes, which are two of the biggest risk factors in CKD. And atherosclerosis, which is plaque buildup in arteries, also causes high blood pressure and reduced kidney function.
Hi, I'm Claire, and I'll be presenting a little bit about BMI and just some exercise examples. So basically what BMI is a general estimate of your body fat, and it uses your height and weight. So there are basically three categories. If you're under 18.5, that means that you're underweight, and then 18.5 to about 24.9 is a normal or healthy weight range, and then 25 to 29.9 means that you're overweight, and then if your BMI is 30 or higher, then that would be classified as obese. So a big note about BMI is that it is not necessarily always a completely accurate way of assessing body weight, but it is a good way to get a general sense. Like a lot of bodybuilders are classified as obese, even though muscle, they're all muscle because muscle mass just weighs a lot more than fat. So it's dependent, but yeah, it's a good way to just get a general idea for the average person. So moving on to examples of some exercise activities that you can do. So there are three types of exercise categories, and that's based on the amount of impact, which is the amount of stress that these exercises have on things like your joints. So examples of high impact exercises would be running, hiking, aerobic exercise, playing contact sports, anything that is just going to have a lot of stress on your joints and something where you're like hitting the ground a lot. Moderate impact would be things like walking, swimming, and yoga, to where, you're not constantly doing repetitive motion that stresses your joints, but you're still moving your body and, maybe your legs are hitting the ground, but albeit at a slower pace. And then the third would be low impact. So that's, very gentle exercise, things like arm circles, things like leg stretches, things like, yeah, chair yoga. So it's, very gentle on your joints, but it's still, exercise. So, things that we recommend are casual walking or biking. Both of these are pretty low impact. They would be classified into the moderate impact category. And for walking, it's recommended that you get about 30 to 45 minutes of walking a day. So you could do this, by traveling between places, especially if you live in the Bay Area. A lot of our communities are pretty walkable. So that could be walking to a park or a grocery store, or, even just walking up and down stairs. Another thing could be bicycling. So, instead of taking your car, if you're able and you have access to a bicycle, it's a really good idea to, use a bicycle, or even a stationary bike is also good. So another thing is, if you have joint issues, if you have arthritis, you've gotten a hip or a knee replacement, swimming is a super good option. If you have other conditions that prohibit you from doing things like that, you can also do seated exercises and chair yoga, and you can, move around while sitting to keep your joints from moving. So a couple more ideas from exercise would be, the first one is continuous aerobic exercise or cardio. It's really good for fat burning. So it's also really good for maintaining healthy levels of blood pressure in the body. So that's things like jumping jacks, push-ups, burpees, mountain climbers. So if you do any of these for like 3 days a week, it's great. Just try to get it in, even if it's 20 minutes a day, and, trying to work out on non-consecutive days so you have a rest day in between. So here's some free places to exercise. So if you live in San Francisco, Mission Dolores Park is very good. It's open from 6 a.m. to 10 p.m. and it's a very wide open grass area, and it's has free public restrooms. And there's also, right by Mission Dolores Park, there's a pickleball, basketball, and tennis court. That's also really good for working out on. Another really good place is Alone Park. Again, it's free, but it's in Berkeley. I believe it's in about Northwest Berkeley. I'm not sure if that's right, but It's 5 blocks of open greenery, and they have an outdoor exercise obstacle course kind of thing and bars if you know that you're into calisthenics and things like that. The third is Seven Seas Park. It's open from 6 to 9. It's in Sunnyvale if you live in the South Bay, and it's got a really big playground that is actually for adults as well. And you can also take your dog there. They have a nice open field as well and a dog park. And then if you live in South Berkeley, there's also another park called Willard Park. I believe it's open from sunrise to sunset. It's also a really good place. People are always playing frisbee there, bringing their pets, and just a big green space. So, usually you can find a green space near you that is nice to exercise. So yeah, thank you so much for listening to our exercise presentation, and I can pass it off to the next speaker.
Thank you so much, Claire. Our next slides that we will present is about transportation. And again, if you could just give me a moment to transition to those slides. Okay, yeah, here is the transportation and chronic kidney disease related slides. I know that many of you here have attended today's presentation because of this, so we will try to elaborate as much as possible on this. So just basically prefacing this, what is the problem? Patients with diagnosed with chronic kidney disease, which then progresses into end-stage renal disease, and then undergo dialysis 3 times per week. So this should say end-stage renal disease and those who undergo dialysis, because this is mainly for those who undergo dialysis. And those who undergo dialysis, have to attend 3 times per week, and it can be a struggle to access reliable transportation to the hospital to receive this treatment. And the social determinant of health that this covers is that the availability of transportation is a social determinant of health because it is sensitive. The lack of transportation can prevent medical visits and ultimately delay care and early prevention. And so here are just a bit of stats on chronic kidney disease. I know that we went over some stats earlier, but just as a review, about 6% of American citizens suffer from chronic kidney disease. In Alameda County specifically, decrease to access to transportation for seniors aged 65 and above is associated with limited access to kidney disease management and healthcare resources. In the US, an estimated 5.8 million individuals delay medical care every year due to transportation barriers. And this is a big thing that we try to mitigate as much as possible. And also, seniors are least likely to use public transportation due to mobility challenges. And so how does transportation lead to health disparity? One way is access to healthcare. Limited access to transportation leads to difficulty reaching healthcare facilities or delayed or missed medical appointments. And this can be a big burden for those who live far from a dialysis clinic. Maybe some people may live in rural areas, or they do not have access to a car, so they have to rely on public transportation. But unfortunately, time or money, which is required of public transportation, do not come very easily for dialysis patients because dialysis is a very expensive treatment. It can also impact access to healthy food. So those who have transportation difficulties may have difficulty accessing grocery stores that offer those healthy foods that are vital to a kidney diet. And we will just go over a kidney diet in a later slide, but yes, this can lead to higher risk of obesity, diabetes, and cardiovascular disease. And so it is a big complication and is again one that we are trying to minimize as much as possible. By, for example, one of our philosophies here at KSAP is that we come to the community rather than them coming to us. So we want to mitigate the transportation part as much as possible. And it can also discourage physical activity because people may not choose to bike or walk long distances. Again, people may be physically impaired, which can impact not only accessing those dialysis clinics, but again, as we spoke about earlier, their lifestyle and their physical well-being as well. And it also it can exacerbate existing social determinants of health, such as education and employment opportunities. Those on dialysis care must attend dialysis frequently, so it conflicts with their work time schedules. Those who are on dialysis may, for example, they might have to do a dialysis session, but maybe their boss wants them to do a particular project, and so these can be conflicting, and this can unfortunately impact employment. So dialysis patients do also face lower rates of employment, which is a big and unfortunate experience. And this can also cycle to poor health outcomes, limited access to resources, and reduced opportunities for social mobility. And then also emergency medical services. For those who may have complications accessing these, emergency medical services may be delayed or inaccessible. And so that can lead to poor health outcomes, and it can exacerbate further disparities. And so here are just some current resources for transportation, and this is specifically for seniors, because these services mainly cater towards seniors. That is their main focus. So the first one is non-emergency medical transportation. And this is a service provided for seniors to reach medical appointments and receive treatment, such as dialysis care. There's also GoGo Grandparent, which facilitates transportation for seniors, but also provides additional support such as food and pharmacy deliveries and prescription medication orders. There is the paratransit program, which provides specialized transportation options for individuals with disabilities or health-related mobility challenges, ensuring safe and reliable door-to-door transportation to medical appointments and healthcare facilities. There are also free door-to-door rides via volunteering driving programs. I know that some programs here at UC Berkeley do offer that. So if you live nearby, near Berkeley, around the area, you can look out for those to access your medical appointments. And it doesn't just have to be dialysis. It can also be just, a regular doctor checkup or anything like that. We do provide those here at UC Berkeley. And there's finally the travel training program for navigation guidance on transportation. And this basically just helps you find those transportation resources, find how you can best access those appointments, because we do want you to look out for your well-being. And this is one of the ways you can do that. And again, here are some other possible solutions. So you can create a mobile health center with primary and preventive healthcare services. I know that one of the things that Shavonde does is, helping people become more familiar with technology. So this can be a great opportunity to do that. You can also set up voluntary ride programs. Maybe you have someone that you go to dialysis with. You can set up a rideshare program with them. Not only can this save time and money, but it can also spark a new friendship. I don't know, maybe you can become best buddies with that dialysis partner. You can also establish new public transport services to target the senior population, and there are also partnerships with ride services for people who live in areas not covered by public transit. So like I explained before, rural areas may not have as much access to public transport, and so these are a great option for that. And yes, that was the last slide for transportation. Now we will go on to nutrition. If you could give me a moment to transition again.
Or hello. This is. Can you guys hear me, by the way? Oh, can you guys hear me?
Yes, we
Sorry.
can hear you. Thank you.
Okay, sorry. Yeah. Uh, Hello. So this is the nutrition and the diet section of our KDSAP presentation for today, and the tips will be brought to you by National Kidney Foundation. So why is diet important? Important. Basically, we want to acknowledge first the kidney functions, as the main ones are that they filter waste from the blood and maintain the nutrient balance and maintain blood pressure that goes on constantly within our bodies and is maintained through homeostasis. Um, and basically, kidney diseases prevent these kind of functions, uh, since they will lead up to the buildup of waste and extras and a bunch of waste products, and then the body will retain too much fluid, basically causing kidney damage and an imbalance in body function, which is something that we don't want. Definitely. So what we do recommend is a renal diet, which is often low in sodium, has low in sodium, phosphorus, potassium, and protein, but is kept at moderate levels. And basically, this will help us reduce the risk of losing kidney function. It will slow down disease progression and prevent other health complications such as muscle function. So yeah, some diet considerations, as we said before, basically keep in moderation for basically four main types of nutrients, which are protein, phosphorus, sodium, and potassium. And basically, if you want to keep these in moderation, since kidney disease is often linked with um, since overconsumption of these protein, phosphorus, sodium, potassium could be hard for the kidney to filter over time, and at a given point in time, if you do overeat these, it will cause kidney damage and often high blood pressure, which will, then will cause more kidney damage, which, yes. So it's something we want to avoid. So basically, look out for foods with high protein, high phosphorus, high sodium, high potassium, which include red meats, and keep these into moderation, such as poultry, fish, phosphorus, some foods I eat commonly, nuts and seeds. So you want to keep those into moderation as well. Sodium, especially these include like processed meats that you find like with like sausages, chips and snacks, which are often common in supermarkets, and especially soy sauce, which is some of our favorites, but definitely it's something we need to look out for. And finally, for potassium, as much as we love, a ton of us love our fruits, bananas, avocados, we need to keep those into moderation, and they are good. They have a lot of nutrients, but it's definitely important to keep in mind that. And so these high levels can, as I kind of said before, especially for sodium, rise in blood pressure, as it, and which could then leads to more kidney damage, swelling and puffiness around certain parts of the body due to increased vasculature or increased blood pressure. Potassium, irregular heartbeats, heart attacks, and potassium, and this goes along with phosphorus, since they're important for normal heart function and play an integral role in that. Stroke, death for phosphorus, protein. Yes, so high levels of protein will cause weakness and nausea over time as they're built up in the blood, and high levels of protein is not favorable, and it will cause a lack of normal body function. So yeah, so here are some healthy food examples that we do have in mind, and these are brought to you by the Mayo Clinic, and there are more recipes on the Mayo Clinic as well that you can go explore. Basically, here are some examples. That's just a fettuccine with clams based on tomato. This is known for having low sodium, low fat, low sugar, and you could serve up to 6. So the recipe will allow you to, you know, gain up to 6 servings, and you can say that for overtime or for other people. Uh, fish tacos with tomatillo sauce, baba ganoush, and mango salsa pizza. We got some exquisite ones here. So, such as the most importantly, with the mango salsa pizza, you got high fiber too, which is another nutrient that you definitely want, and healthy carbs, and only takes around 20 minutes.
And just a quick note on these examples, Katie Sap is coming out with a video outlining the recipe for the fettuccine with clams, basil, and tomato recipe. So if that sounds interesting to you, please be on the lookout for that on Katie Sap's website and social medias.
So yeah, finally, just to close off, we have diet resources here and some tips actually for if you want to if you would like to make a sort of diet for and that is closely related to the renal diet. We recommend that you connect with a renal dietitian for diet tips, and as opposed to maybe connecting with a doctor or a normal family doctor, since they will have more specific tips and and they will cater to those specific needs that you have in mind in acknowledgement of chronic kidney disease. Renal dietitian, so yeah, they have more specialized knowledge on kidney function, bones, and hearts, and their interconnectedness. You could also visit, so to do that, you want to visit the www.mpidb.org. They will have, you want to go into doctors, dietary nutritional services, provider section, and nutrition, renal, and you can basically follow these steps and find a nutritionist close to you and get into contact so you can get towards a more healthier lifestyle within the diet aspect and prevent kidney disease.
Thank you so much, John. That was it for the nutrition slides. And finally, I would just like to take a moment to show our Katie Sap website, maybe for those of you who might be interested in our screenings. I just wanted to show you our website because we regularly post our screenings there. If you could give me a moment to transition to that. Yes, so here is the website for KDSAP. You can see here that this is our homepage, and it has a lot of pictures here. You could just basically see what we do. We go out into various communities hosting various sessions. And yeah, we have a big group of people here, and we include stations like this one, for example, is the blood glucose station. And let's see here. This is registration. This is and this one is the blood pressure. So we do host a variety of stations like I elaborated on earlier. And you can see here we have our purpose here, our history. We were founded by Dr. Lily Shao from Harvard University. And we do have our physicians. These are physicians, MDs, that come to our screenings to give you a physician consult. So these are qualified physicians that come, and it's not only these physicians that come, other physicians do volunteer. So you are getting reliable information and qualified information as well. And yeah, so we have our screenings over here. We have not updated our screenings yet, but this is our fall 2023 screening report. You can just see the broad spectrum of screenings and communities that we've gone to. So this one, for example, is the Bethlehem Missionary Baptist Church. We have done screenings at the Suitcase Clinic, which caters to individuals who are unhoused. And then we also do Southeast Asian Community Center. So we do a variety of screenings. And so these are just a bit of pictures from our screenings, our past locations. If you would like to go and look at that yourself. And then here are just like a bit of even later screenings that we've done. And so here for patients, you can navigate to this. We do offer translations, so English, Chinese, Spanish, and Korean. You can access those. Again, as I said, we do try to prioritize accessibility in our screenings. So this is one of the ways we do that. And yeah, that is our website. If you would like to learn more, you can visit yourself at ucberkeley.com. And yeah, thank you. I would like now to open it to any questions that you guys may have. And again, if any of the KDSAP general members would like to answer as well, please feel free to.
Well, before that, I just want to say thank you so much. I want to take a moment to extend this heartfelt thank you to our wonderful presenters from Berkeley, Katie Sapp. You guys have been a great partner for us the last 3 years. And during the pandemic, you guys educated a lot of seniors. So thank you for your knowledge and expertise on kidney health. And, the way you guys do and the work in the community is just commendable. Thank you.
Yeah, no, thank you so much for having us. And thank you to all the viewers out here. I know that your schedules can be busy. So taking time out of your day means a lot for us, not just to us KDSAT members, but also to our mission of spreading awareness for kidney disease and trying to prevent the progression of kidney disease as much as possible as well. So thank you so much for that.
Any questions for the team here? There was a question from Amy. Maybe one of you can go through the answers and the questions for the audience before we go.
Yes, I do see that question. Kirby, since you were the one who answered that, would you like to go over that answer?
Yeah, so generally, people with chronic kidney disease are at risk of two different types of infections: or urinary tract infections and bacterial infections that you can get from the access site when you're having dialysis. Um, Typically, having chronic kidney disease also coincides with general uh, immune system compromisation. So you would be at high risk for viral infection, from the flu, things like that. And generally, I'd say that the two that I listed, urinary tract infection and dialysis active site infection, are the two to look out for.
Yes, definitely. Are there any other questions that we could answer? We would be honored to. You could send in either the chat or you can unmute and say your question aloud. We would be honored to answer them. Okay, if there are no more if there are no questions, yeah, that will be it for the presentation. And once again, thank you so much everyone for attending. And again, thank you for having us here and spreading our awareness for kidney disease. So yeah, thank you so much for attending. And yeah, that would be it. Thank you.
Thank you, guys. Thank you,
Thank
Annie. Thank
you.
you, Claire. Thank you, Kirby, Stephen, and Savon. Thank you. Take care. Bye-bye. And Charity.